Moving on to tetracyclines in part 2 of chapter 41. Tetracyclines are broad spectrum antibiotics that are actively taken up by bacteria. They are bacteriostatic and they bind reversibly to bacterial ribosomes to inhibit bacterial protein synthesis. Tetracyclines affect both gram-positive and gram-negative bacteria. They're especially indicated for the treatment of Rocky Mountain fever, cholera, urethritis, and Lyme disease. And tigecycline is used for MRSA, methicillin-resistant Staph aureus, which is a very resistant bacteria. Let's see. Tetracyclines interact with a few medications, specifically calcium, antacids, and mineral supplements. It can inhibit the absorption of tetracyclines, so we like to give them about 2 hours apart. Adverse effects of this medication include, or this class of medications includes nausea and vomiting, diarrhea, fungal superinfections, as well as sensitivity to the sun or photosensitivity. So we want to be careful with this medication in kids. It has been contributed to stunted growth. Tetracyclines bind to calcium and are deposited into growing bones and teeth, which can lead to stunted growth and mottled appearance of teeth. Let's see, moving on to tetracyclines within the class, the drugs within the class. Democlocycline, doxycycline, minocycline, tetracycline, and tigecycline. As you can see, they all sound very much alike and they fit right into that tetracycline class. Sulfonamides are a synthetic drug, not found in nature. We made this drug. They're used topically to treat burns, prevent infections within burns, as well as urinary and GI tract infections. They are bacteriostatic. They block the synthesis of folic acid, which is a necessary step in a life cycle of any cell. So if you can block the synthesis of folic acid, you've essentially halted this bacteria within its tract. It inhibits bacterial growth, thus producing a bacteriostatic effect. Adverse effects of sulfonamides include nausea, vomiting, and diarrhea, dehydration and deposits of crystals within the urine, allergic reactions such as rash as well as sensitivity to the sun, and a serious skin reaction called Stevens-Johnson's, which would be a reason to discontinue the medication immediately and seek attention. Drug interactions include anticoagulants and hypoglycemics, such as Coumadin and any of the oral hypoglycemic drugs. Let's see. The one you might be most familiar with from this class is sulfamethoxazole and trimethoprim, which is called Septra or Bactrim for a brand name. Trimethoprim increases the effect of stopping folic acid synthesis and therefore is synergistic with sulfonamides. It's indicated for a broad spectrum of gram-positive and gram-negative bacteria, again, respiratory, urinary, ear, sinus, and pneumonial infections. So lots of uses for sulfonamides listed out in slide 34 as far as the different drugs within the class. So moving on to macrolide antibiotics. These include your erythromycin, azithromycin, and clarithromycin. Erythromycin is used for, well, they're all used for a number of different things. Azithromycin most commonly in respiratory infections. Clarithromycin is more potent than erythromycin, and it's used to treat the same bacteria as erythromycin, which includes Legionnaires and genital infections. Clarithromycin can also be used to treat Lyme's disease. I'll let you guys cover slide 36 on your own. These aren't commonly used. I would say azithromycin and erythromycin are the most commonly used antibiotics in the macrolide class. Moving on to fluoroquinolones, very popular class. They all end in floxin or floxacin. So ciprofloxacin or ciprofloxacin, moxifloxacin, levofloxacin, they all fit right into that fluoroquinolone class when you hear that end name there. They're synthetic antimicrobials. They work against gram-negative, they're broad spectrum, and they're well absorbed. So, adverse effects of these medications, and they're used for various things like respiratory infections, urinary tract infections, a bunch of different options there. Let's see. So, generally not used in children or pregnant women because it can cause evidence of cartilage defects, tendinitis, and joint pain. Adverse effects include headache, dizziness, GI disturbances, as well as sensitivity to the sun. So moving on to miscellaneous antimicrobials, specifically chloramphenicol is our first one we're going to talk about. It's broad spectrum and used for serious or life-threatening infections, and it's bacteriostatic and inhibits cell wall synthesis. Two of the main indications are typhoid fever and certain types of meningitis. Common side effects of this medication include nausea, vomiting, bone marrow depression, and it's a very toxic drug, which is also why we don't use it too often. That bone marrow depression is one of the main, and the blood disorders that can come along with it are one of the main reasons we don't use this medication too often. In most cases, these effects are reversible, so that is why we can use them in life-threatening infections. It should not be administered to infants under 2 weeks because it can cause gray baby syndrome, which is literally the baby turns gray because they're suffering from a hypoxemia. Another miscellaneous antimicrobial is clindamycin. It's bacteriostatic in that it inhibits protein synthesis. It's effective against gram-positives and anaerobic organisms, and its most common side effect is diarrhea. Metronidazole is an antimicrobial drug that is bactericidal to both anaerobic bacteria and protozoa. It has no activity against aerobic organisms, and it was first introduced as an antiprotozoal drug and is considered the drug of choice for infections such as trichomonas or trichomoniasis, giardia, and entamoebas. So, adverse effects include GI disturbances, metallic taste, and again, just like cephalosporins, that disulfiram-like reaction when given with alcohol. Vancomycin, I think, is one of our last that we're going to talk about, I think. Vancomycin is really commonly used, not absorbed through the GI tract, but it can also be given via injection. Indicated for treatment of resistant staphylococcal infections as well as Clostridium, which is a GI tract infection. It's bactericidal and interferes with cell wall synthesis. Adverse reactions following IV administration include chills, fever, phlebitis, and a condition known as red man syndrome, especially if the administration is too rapid. Within the past several years, vancomycin, unfortunately, bacteria have become resistant to vancomycin, and we now have what we call VRE, vancomycin-resistant enterococci. Kind of terrifying because for a long time, vancomycin was our strongest antibiotic used to treat some of these scarier bacteria. So moving on finally to drugs that treat tuberculosis. I'm probably going to let you guys cover this one because I'm starting to lose my voice. So cover it on your own, become familiar with those drug names. That is the only thing they're really used for. And if you have any questions, feel free to contact me. There is a lot of information in this chapter. The best bet for you would be to become familiar with the names and the classes that these medications are in. Other than that, like I said, if you have any questions about specific antibiotics, please contact me.